Likely originating in East Africa or Asia, leprosy is a plague that has been around for hundreds of thousands of years. Leprosy, or Hansen's disease, named after the Norwegian physician Hansen who discovered the microbacterium leprae, is a disease that affects skin, nerves, and mucous membranes. Due to the slow rate of growth for these bacteria, it may take any time between 1 to 20 years to develop signs for the infection, with an average incubation time of 5 years. As a result, it's extremely difficult to pinpoint the source of infection. Often, the disease is acquired in childhood, with the majority of infected being males. Scientists are not 100% sure on how humans contract leprosy, but they currently believe it may happen when an infected person coughs or sneezes and an uninfected person breathes in the droplets containing the bacteria. Leprosy is not passed on by things like birth or sexual contact. Instead, prolonged close contact with someone untreated over the course of many months is necessary to catch the disease. There are several animals known to transmit leprosy, most famously the nine-banded armadillo, but can also include non-human primates and squirrels as well. Symptoms mainly affect the skin, nerves, and mucous membranes. Differences in the severity of symptoms stem from the immune status of infected persons. Tuberculoid leprosy presents in those with higher resistance, resulting in being less infective and affecting fewer limbs. Lepromatous leprosy presents in those with lower resistance, resulting in being more infective and more severely affecting the limbs, nerves, face, and skin. According to the CDC, if left untreated, the nerve damage can result in paralysis and crippling of hands and feet. In very advanced cases, the person may have multiple injuries due to lack of sensation, and eventually the body may reabsorb the affected digits over time, resulting in the apparent loss of toes and fingers. Corneal ulcers or blindness can also occur if facial nerves are affected, due to the loss of sensation of the cornea of the eye. Other signs of advanced leprosy may include loss of eyebrows and saddle nose deformity, resulting from damage to the nasal septum. Throughout much of history, those with leprosy were stigmatized and forced to quarantine in leprosy colonies and asylums, also known as leprosaria. These days, diagnoses are made by looking for the presence of the bacteria in a skin or nerve biopsy. Extensive multi-drug treatment is used to cure leprosy, which can take several months, but ultimately can fully cure the disease. It is extremely important to remember that although the antibiotics used during the treatment will kill the bacteria that causes leprosy, it does not reverse the nerve damage or physical disfiguration that may have occurred before the diagnosis. Early diagnosis is key to minimizing all effects.